Okay, so let's say, you're going through your run and you finish your run and you have a little nagging pain that kind of comes and goes. Just pay attention to it. So, your body experiences pain when it feels like something isn't right.
Hello, Ironman and beyond. It's weekend, but guess what? We are here and we are actually so fortunate to have Dr. Michele Rebozzi, one of our special guests for this week. And let me introduce you, Dr. Rebozzi. Actually, I've been working with Dr. Rebozzi for a while now. So Dr. Michele Rebozzi has a doctorate in physical therapy and has also completed the Movement Performance Institute Lower Quarter Biomechanics Fellowship Program under Dr. Chris Powers. Wow, that's long. She's also a board certified orthopedic specialist through the American Board of Physical Therapy Specialists. Her interest includes ACL rehab, injury prevention, sports rehab, running, and cycling analysis. This is a good part. She is also a triathlete, so she knows and understands what we go through because she does it herself. Plus, she also serves as the lead assistant coach at Life Pacific University for their women's basketball program. So, welcome, Michele, and thank you so much for having us. I know it's weekend. You could be somewhere watching a movie or Netflix, but you are here. Thank you so much for your time. How are you doing, Michele?
Of course. I'm doing great. I'm excited to be here and hopefully I can help the athletes out. So
awesome. Great. Well, let me show you guys how I met Dr. Michele. Okay. Oh, I remember now. Don't you remember whenever you feel something like what I felt is actually knee pain. So I was actually cycling in the mountains. It was like back to back training for the Red Bull Trans-Siberian Extreme. And that was back in 2017. That was about 4 or 5 years ago. So when I was training, I'm like, but I still need to train tomorrow and my knee is not holding up. What am I going to do? Right? So by that time, I was so frustrated because I was doing everything I can with all my power, like everything. I was doing my strength training. Also, I was seeing my personal trainer, but it's not working. So what I did, I went to see I went to go to, let me see, Covina Hill Sports Medicine, where I met Dr. Michele. So that was the first time I met her, and she was actually referred to me by another Ultraman finisher, multi Ultraman finisher. And so I talked to her and what's going on. And so she helped me out. What she actually helped me out was that she did a running analysis on me and then also cycling analysis. Actually, I have a video here. Let me show it to you. Hold on one second if you guys don't mind, so you guys can understand what that is. So I did post this one last time. Hope you guys see it. So take video. So she can explain more later, but she puts some electrodes here. And I think, let me see. There's this part here. Yeah, so those are the ones that she put there. She made me run also. Okay, so this is a machine that they have in the clinic. And what's good about this one is it's not subjective, but they actually go by numbers wherein they were able to see and determine the strength of my glutes, right or left. And one of the great things that actually Dr. Michele told me is I think it was my left glute. Your left glute is so weak and your right glute is not, and therefore blah, blah, blah. So there I've learned a lot. And I'm like, why? I'm doing all this. I was meeting my personal trainer already. I was going to the gym. How come it's not strong? So that was an eye-opening to me. I mean, I have all my experience, but until I actually saw and met someone who's a professional like Dr. Michele, who knows what she's doing, especially she's also a triathlete. That was actually eye-opening. So she actually prescribed to me, okay, these are the exercises that you need to do. So from there on, I've learned a lot from her. And I know it's a long introduction, but I wanted to show you that how much she has helped. So one of the things that she has done for us is that she actually does master classes for 5C-FACS. Like, for example, this one is about hamstring care. It's not only she's kind of like me. She doesn't just talk. She actually wants to make sure that you understand what she's talking about. So she would like do a demonstration. And then let me see, she also did the lower back. So this one is knee pain during the off season, lower back, hamstring, and she answers questions. She's just so generous. So again, thank you so much,
Thank
Dr.
you.
Michele. Yeah, she's been with us for like about 5 years now. So today we're going to be talking about knee pain. I'm going to shut my mouth, and basically what I'm going to do is just spit out all the questions instead. Let me say hi to those who are listening right now or who's on the line. It's welcome Cheryl, Christina, Tess. So anyone else who are actually tuning in, #live. And if you're in or tuning in or listening to the replay, just #replay so we know who's who. And just feel free to actually ask a lot of questions. So now that we're talking about knee pain, which is really, really common, don't you think, Dr. Michele? How much of the athletes that you've seen, that knee is usually the one that's the reason that they're actually coming to you for help?
Yeah, a lot. So the knee is tricky because the knee is stuck between your ankle, which moves in a lot of different motions, and your hip, which moves in a lot of different motions. So if you're having issues in your hip or issues in your ankle, your knee is going to take the brunt of the force. So there's it's very common in running, cycling, even, and yeah, swimmers.
Does it vary, like in terms of age, or like whether female or male, or is it like just really a common thing? It doesn't matter what age or like what kind of athlete they are, or like what kind of levels?
Yeah, I think as you get older, obviously it's going to put you at more risk. And then it really depends on your training type and your movement mechanics. So women are more likely going to have knee pain versus men because of our hips and our structure.
I see. So now, one of the things, I mean, the knee structure, you just mentioned the knee structure. And in my own words, or like if I may just make it easy and like simple language, like, okay, where's your knee pain? Side, left, back, or top, and then, or like this, and then, or like screenshot, Buddha. But how about walk us through, just, kind of like give us a quick big picture. What's going on with the knee? Yeah, I think, yeah, just give it all.
Okay. I can give you a quick picture, and
yes, please.
If you guys want to see a picture, I can show too, but
oh, please, I think better picture if you have it. That'd be great.
Okay.
Yeah. Oh no, my knee hurts. Yep, that is all right.
Okay, so basically you can look at the knee in 4 different parts. So you have the front, the back, the inside, and the outside. I would say the most common is going to be anterior knee pain, which will be in the front. This picture right here, so you can see there's going to be 3 main things in the front. So if you just touch the middle of your knee and you feel your kneecap, that's called your patella. So it's common to have pain around that area. So right around this joint, that's possible. That would be called patellofemoral pain. And then you can have it in the tendons above and below the kneecap. So if you just touch your kneecap and move your fingers down a little bit, that's going to be called your patella tendon.
I see.
If you touch your kneecap and move up, that's your quad tendon. And like I said, just around the kneecap, you can develop patellofemoral joint pain. Then in the back, if you're having pain in the back of your knee, it could be 2 different things. Usually, this is obviously very general, but you can have muscular pain, which is what this picture shows. So this is looking at the back of your knee. You can see right in here, this is going to be the top bone of your thigh bone, and then your lower leg bone right there. So these muscles, these are your hamstrings. These muscles are your calves. They insert right behind your knee. So if you potentially, have a lot of hamstring pain, or pull your hamstrings, or calf pain as well, you can develop posterior knee pain, which is just pain in the back of the knee because of that. The other is you can actually develop joint irritation, which is going to send, I'm not sure if you guys have heard of a Baker's cyst, but that's basically joint swelling. And that's going to present as a kind of like a big knot in the back of your leg that could cause knee pain as well. And then on the outside of your knee, so right here we have a ligament that connects our bones called the LCL, and we have a meniscus on the outside of our knee. The other thing is the IT band that also is going to run on the outside of your knee. And then on the inside, you have the same thing. So you're going to have a ligament that connects the inside of your knee and the meniscus that lays, at the bottom of the knee on the inside. So those are all possibilities of how you can injure those areas. Now, ways you would injure them, there's two main things that I would say are most common, and that can be changed through physical therapy. And that's going to be your movement mechanics and your strength. Okay. And I just have a couple. Yeah. Oh, sorry. Do you have a question there?
Oh, yeah. Hold on one second. Do you think I can share, or you can stop sharing? Because I do have, I do have a question on that. So I know you showed the structure, right? Is there something more like, okay, this part is a serious one. This one is okay, not so bad. I'm looking at more of like athlete's perspective. We want, so which one is it like, are they something that anything that if I feel pain here, that's something that I really need to take care of?
Good question. So I would say if you have had a blunt trauma to it, that is something you need to go get looked at, because potentially that could be like a tear, whereas physical therapy or conservative care wouldn't actually fix that.
I see.
100%. But if it's, an overuse injury, which is usually what it is, if you have pain in any of those areas, it's not like an emergency, but it's probably not going to get better on its own. You adjust your training some way, or do something to change the stress.
So it really depends. So like, for example, in any of those areas, depends on the intensity or how bad it is, whether or what kind of care that I'm going to have to do.
Exactly. Yeah.
Oh, okay, gotcha. Hey, Alicia, welcome, Alicia. So anyone who's just joining in, just #live, welcome, and let's enjoy. Hopefully you guys got the picture of that knee. If you guys have any question there, did you guys get that one? That's pretty serious thing. But that's what's inside there that we are actually gearing to actually understand more. So now our athletes who are listening here are generally triathletes. So they're swimming, cycling, or running. Are they, like, for example, swimmers, would they usually get some knee pain, or usually it's just more of cycling or running, or does it pick?
Yeah. So generally, right, the cyclists and the runners are a lot more common. Swimmers are normally going to be dealing with shoulder pain. But seeing, knee pain in swimmers, and that usually has to do, it just depends on their stroke and the type of kick.
Too much kicking.
Yeah, too much. Yeah, exactly.
Which is not the right technique. All right, so let's go cycling and running. So you were showing really good presentations there. I wanted to check that out. So what are those that you were showing? It looks like, the knee was collapsing or like going inwards. Can you show that to us? And then are those like the possible causes of why a person would actually have a knee pain?
So these would be reasons you would develop overuse injuries. So obviously this runner looks like she's an elite runner, but she's landing with, see how much her knee is diving in, the middle of her, almost at the inside of her ankle. So what this does is this puts a lot of stress. It overstretches everything on the inside of your knee. And then it's going to compress everything on the outside of your knee. Okay. So that would be like, if you have meniscus pain on the outside of your knee, maybe you're landing like this. If you're having, knee pain on the inside because it's overstretching your MCL, you potentially could be landing like this. And then this is also a big cause of IT band pain, because the IT band is going to connect from your hip all the way down past your knee. So if you land like this, the IT band is very thick and it just is getting overstretched every time. Gotcha. So this is definitely going to be more common than this next picture. But you can see in this picture, this guy's outside. Diving in. Yep, they're going out. So it's going to do the exact opposite, where it's going to overstretch the outside and then compress the inside. And
Are
then,
this- yeah.
oh, no, go
Are
ahead,
this-
go ahead.
Are this more like posture? Like they probably, like for example, the lady on the left side, like that's just the way she runs, and that's why it's becoming like that, or is it because she's getting tired, or she just or like maybe the shoes? Like what could be the reasons why her running is like that?
Yeah, good question. So a few things. It could be structural, which is in your hip.
Okay.
The other thing, which is the most common factor, is actually hip weakness. So if your butt muscles are weak, your butt muscles control the way your leg moves in and out. So someone with strong glutes and that knows how to use them when they run won't necessarily land this way. The other thing is it could be coming from your foot as well. So if you have really flat feet, or if your shoes don't have really good support, that potentially could play a factor.
Yep. Okay. So that actually explains what I learned in the run gait analysis we're in. It could be ground top going up is the cause, or from the top ground, which is the cause. It could be from the hip or the ground. Okay, got it. What if it's both? That's bad, right?
If it's both, you just need a lot of exercises.
Oh my God. Okay. All right.
There's still hope.
But that kind of sucks, because the thing is that not all runners would actually take a picture or take a video, like usually they won't even know how they run until they actually start having pain. Right. And those are the people that you would usually see, right?
Mm-hmm. Correct.
Yeah. I see. And then how about the person or the man on the right side? Why is that? I agree with you that it's more common on the left side, honestly. Like before I was like that, or sometimes when I'm like have muscle imbalance, I would be not as worse like that though. but on the right side, that's kind of seldom, is it?
Yeah, totally. This is way less common. This is going to be more structural.
It's out.
Yeah.
The knee looks like it's outward. It's pointing outward, right?
Exactly. Yeah.
Is the sign of this, like for example, when someone's walking, and I guess the toes are pointing outward, could that be a reason coming from the knee structural? Or not really?
It could be. Yeah, it could be. It's going to be mostly how the person's hips are sitting, I would say.
Okay, gotcha. Yeah. Where is the pain usually, if it's this kind usually?
So yeah, if you, and this is also known as bow-legged. So if you've heard tell you, oh, you look like you're running bow-legged, maybe this is.
Oh my God.
So yeah, mostly the pain here is going to be on the inside because you're compressing your meniscus here. But it potentially could be on the outside as well, because this position is going to stretch your IT band, and it's also going to stretch your LCL. So
I see.
Yeah, it could. Yeah.
I have a question here, actually, from Alicia. Alicia, welcome, and Fanny, welcome. We got more people coming in. So Alicia is actually asking, I have a chronic peroneal tendinitis in my right ankle. I don't know if it's related, but my right knee feels like it's going, ouch, Alicia. My right knee feels like it's going to pop, or it needs to pop. It doesn't hurt. I think it's like the cracking, I think. Correct me if I'm wrong, Alicia, but it doesn't hurt at all, but it's just uncomfortable. Could this be a serious, or is it this just probably just inflammation? What do you say?
Good question. So it said peroneal.
Oh, okay. Yeah.
Is that what it said? Okay.
Yeah.
So peroneal is going to be on the
perennial. Is that the same? Peroneal. Okay.
Yep. Okay. So that's going to be mostly on the outside of your leg here.
Okay.
On the outside of your ankle. So that it's probably nothing serious. It's probably, an overuse injury. So, but if you don't address it, then it could become, you would increase your inflammation because you're constantly going to be stressing that tissue. But yeah, so what that could potentially be coming from is your ankle structure, knee structure, or some weakness, other ankle stabilizer. So on the other side, we have a posterior tibialis muscle. We have obviously the big calf muscle in the back. Depending on how your your legs are landing when you run and your foot is landing, you could be stretching that tendon. So if you're landing like on the outside of your foot, you could be stretching that tendon.
Gotcha.
Yeah. So it's probably something that, you'd want to get looked at.
Okay.
Somebody who can analyze your whole running, especially if it came on from running or whatever brought it on. If it came on from cycling, you're going to want to get that looked at.
I think it's a good thing also to actually give a feedback for like professional like you, whether it's you feel something when you're cycling or when you're running, because there's a difference, right? Dr. Michele?
Mhm.
Is that
Yeah.
right?
So
Okay.
yeah, so some people will come to me that are triathletes and they'll say, oh, I have this, maybe it's the post-tib pain or the peroneal pain while I run, but I don't necessarily have it when I'm riding my bike.
Yeah.
So then we know, okay, well, we should look at how they're running.
Okay. Did that answer your question, Alicia? Do you mind stop sharing, Dr. Michele?
Yeah.
So yeah, did that answer your question, Alicia? All right, good question. Good question. So that was really, really helpful. Let me see. I've had like athletes actually regarding about the back of the knee,
Mm-hmm.
and I know that area is very sensitive.
Mm-hmm.
There's a lot of nerves there, and I tell them don't massage it, no, because it's very sensitive, and you can actually hurt yourself further, right? So the question is more of like a lot of athletes when they have knee, they would just basically stretch. Stretching is good, but sometimes it may not be good, especially with the timing and also what kind of stretching, right? But so for example, if an athlete has like let's say that person is running and then suddenly they felt pain, it's not so bad just yet, just something, what would you recommend for them to do?
Are they in the middle of a race?
Yeah, if in the race,
then you have to keep going and you have to finish.
Get all the pain reliever you can get.
Yeah.
Just kidding. Just training.
Oh, just training. Okay. So let's say, you're going through your run and you finish your run and you have a little nagging pain that kind of comes and goes. Just pay attention to it. So, your body experiences pain when it feels like something isn't right, or something's in danger. That's maybe a intense word. So you always just want to pay attention to it and you don't want it to get worse. Mm-hmm. Things in the back of the knee, there's really going to be three main things it could be. It could be your hamstring. Okay. So if you're experiencing some hamstring pain, that could be because maybe your hamstrings aren't strong enough, or the opposite, they're working too hard and making up somewhere else. With your calf. So your calf could just get sore. Maybe you're moving in a way that you're overusing it, or it's just not strong enough to take your load. The other thing is actually you're developing swelling in your joint. And what happens is that swelling is going to get pushed to the back of the knee. That's called a Baker's cyst. So if you rub the back of your knee, it might feel like a hard ball in the center or in your upper calf area. Mm-hmm. That's going to be due to the way you run. If you land very stiff and you don't have a lot of cushion, in your joint, or your muscles aren't strong to take the load, you can develop the joint inflammation, which is going to kind of get pushed back in the knee.
Gotcha. Good. Yeah. Good. All right. Alicia says, yes, it helped. Thanks. So now I have another question. Okay. So for example, like a lot of cyclists that I would see, and that could, that's one of them, just me too. Someone okay. So for example, like cycling, and there are some athletes like would use their hand and like bam, bam, bam every time they feel something on the knee, kind of like massaging it, like inside of the knee. Is that helping? It's kind of helping because it's more of like massaging it, right? Is that right?
While you're riding or after?
Yes. During ride, actually.
Yeah. So yeah, totally. If you're getting pain in the front of your knee and there's something you can do to alleviate it, then and rubbing, helps, then that's totally fine. What you're doing probably is loosening up your quad muscle. So if you're, cycling is very quad dominant. So if your quad is, just hammering down and it's pulling on your tendons, it's pushing your kneecap down. If you just kind of rub it out, it's just like a distraction, basically.
Gotcha. That would be the muscle imbalances. So I guess would that make sense also whenever, let's say So for example, I had some instances like during a run that I would do, like, for example, if I feel even before my knee actually hurts, like I feel like something's coming, it's during a race. And before it comes, like wherein I cannot handle it anymore, I'd grab an ice and then put it inside my shorts and or somewhere where in my glutes or IT band to actually kind of like lower the inflammation. And it does work because like suddenly like it seems like I'm feeling something. Is it because of that? They're all just connected, get kind of like loosen up or lower the inflammation in terms of the knee?
Yeah. Oh, so you're saying you feel knee pain, but you put the ice on your hip?
Yeah, well, yeah, because I can't hold it. Or like for example, somewhere in my hamstring,
Yeah.
I'll put the ice on my hamstring, and for
Yeah.
later on, like, oh, the knee pain is gone. Like I did not feel it for the entire
Yeah.
race.
Honestly, obviously that doesn't do much to your knee because you're like, it doesn't touch your knee, but what it's doing is it's just affecting your brain. So,
Oh, okay.
it's not, your knee pain is not that threatening anymore. If it's not that bad and
Got it.
you stimulate your body somewhere else, your brain's going to go to that basically.
Oh, okay. Or could it be because my hamstring might be too tight that actually causing muscle imbalance for the knee? Maybe.
Maybe.
Okay, maybe. Yeah. All right, we have another question, Gabby. Gabby, when I run more, yeah, this one is a good question. There are a lot of
Okay.
athletes. Like when I run up to this 8 miles or 10 miles, my knee pain is hurting,
Okay.
Or like,
Yeah.
so it's kind of like that. Let me hear. When I run more than 15 miles, I get pain on the sides of my lower patella ligaments. What will cause this problem?
So running over 15 miles and you get knee pain on the inside of your
lower patella. Yeah, ligaments.
So that is definitely going to be an overuse thing. Does that mean that you can't run 15 miles? Absolutely not. It just means that you have to get stronger and you have to build to your, build your capacity. So it would be beneficial to film yourself. Maybe you could film yourself from the side or from the front, and you could see if you're doing anything that doesn't look normal in running, and try to fix that movement mechanic. Because what can happen is, even if you just have a slight something that's very slight that's off, if you do anything up for 15 miles, you're going to start to feel it. So it could have to do with that. You just have a slight movement imbalance sort of a thing, or a weakness where your muscles just aren't strong enough yet to endure 15 miles or 16 miles. So once you pass that capacity, then you just start, something's going to give, and then you start feeling the pain.
Yeah, I agree. Sometimes it's also training. Yeah.
Yeah. Training. Yeah.
Especially if the athlete's actually like going big volume like right away, and not considering it has to be like gradual progression. So then the next one, knee support. So a lot of athletes would actually wear knee support, and I was using a lot of knee support when I was just a marathoner before, and I was more like dependent on it. But it kind of worked, and also at the same time I will put ice in it, which holds because it holds. But when do we know when we should buy a knee support? Or like, when do we know that it's not going to hurt the knee? Or is it going to hurt the knee? Or is it something advisable? What do you say about that?
Yeah, so I don't think knee supports are bad. They're not going to hurt your knee, but they're not the best thing. The knee support or a brace is a quick fix, right? So I'm having knee pain. Let's just say, I'm going to run 8 miles and I'm having knee pain in the front of my knee. And so I'm going to put a brace on that's going to help fix that. Well, I'm not but maybe the real cause of me getting knee pain is because my quad is weak or my glutes are weak or something.
Yes.
So the knee brace is just masking it. And it's probably, if you were going to advance your training, it's probably not going to last you that long. At some point, the tissue.
I agree.
So like, if you need something, a quick fix, then it's not bad, but it's just, that's kind of what it is, a quick fix.
Yeah, no, I totally agree about that. Especially, what's the long-term solution? Because like, for example, one of the athletes that you've actually helped, Claudia Flynn, who's also Ultraman finisher. There's also Luigi, who's also Ultraman finisher. Well, Claudia even said, like, all I have to do is just Dr. Michelle's exercises and my knee is much better. And I only have to do it like for 10, I think she even said like only 5-10 minutes. Luigi also said like, you know, oh, when I did when I actually was a team captain for Luigi, he was really diligent in doing your exercises, that he would actually do it before he did it before the race, and it's basically glute activation exercise. So he's very thankful about that. Good, thank you. We have another question. So for those who's actually just viewing right now, hashtag live, and if you're viewing the replay, hashtag replay. If you have questions, we still have a little bit of time. We're kind of like extending. Thank you again, Michelle, because we're extending
of course.
But please post your questions. So another question, Edison from Florida, actually. How to correct one leg? Oh, yeah, I know. I think mine too. Okay, so now this one. How do you correct if one leg is longer by 2 millimeters compared to the other one?
Oh, good question.
Yeah.
Okay, so
I think that's like Luigi or myself.
yeah. So first you should have someone look at it. There's two sorts of like leg length discrepancies you can have, structural or functional. Structural, there's nothing you can do about it except for putting a wedge in your shoe. Okay. Structural means that's just how you were built. That's your, your bone structure.
Parents' fault.
Yeah.
I said your parents' fault.
Yeah, exactly. You can still run. You just have to get maybe a custom shoe if it's really bugging you, or build your muscle strength to deal with it. But the other one, though, would be functional. So functional is going to be if your pelvis is rotated one way or the other, and that's due to muscle imbalance. So there's a lot that goes into that. It could be tight hip flexors, tight hamstrings, weak glutes, weak core. It would be probably beneficial. I'm not sure if he can type an answer, but if he's had any professional look at it or
Okay. Have you had a professional look at it, Edison? So we'll wait for your answers. Okay, so we're waiting for his answer. Now we'll get back to you, Edison, okay? Next question. Welcome, Christina. Okay, here. Does running barefoot on the sand, like for example, at the beach, for about 6 miles have any negative effect on the knee? I've done it a few times, but now the back of knee hurts. Or should I do shorter runs? Yeah. You do it. Baby steps. Go ahead, Dr. Michelle.
Soft sand.
Yeah.
Okay, so that's awesome. That's pretty hard training, but so it's not bad, but you just have to have the strength to do it. So, running on the soft sand where the water's not, that's really unstable. And that's a lot of work on your calf. Your calf is working extra hard in the sand because it's trying to stabilize your foot. So your back of the knee pain is probably you're overworking your calf. I'm just taking a guess, but that's what I would guess. So maybe go down the beach more towards the water and start on a little harder.
There you go.
And then, or like what Coach was saying, you can decrease your miles. Yeah. To adjust. So, yeah.
Yep. Yeah. That's actually a good, solution there. It's harder. I mean, that's actually a harder barefoot. Yeah. Hardcore. Okay. So Edison said no. He has not. He has not had it checked. Edison.
Okay. Yeah. So, any physical therapist would be able to.
Okay.
I would say Google a good running analysis in your area. And or just like a good sports physical therapist that could potentially help you with that if it's functional. So
he got it from a Bike Fit. Yep.
Oh, Bike Fit,
which is a good thing. That the Bike Fit are actually see that too. So now let's say we're almost done actually. So now if I'm running or like an athlete is running, how do we know that the knee pain is serious? Or when do the athlete would need to actually see a professional, or who's the professional that we should see first?
Yeah. So I don't know if there's really any serious knee pain meaning like it's a medical emergency, unless you have a blood clot and you're like hot, red, and swollen, or you think you blew an artery back there, which can happen by overuse injury. So that's like a trauma. So, but you would want to see somebody if a couple things are going on. If first of all, you're noticing that your activity is limited and you can't do what you want to do because of pain, and the pain's not getting better, it's either getting worse or staying the same. It's just, smart to go see somebody to help you get on track. A couple things you could try are different strengthening exercises. Okay. If you have someone, instructing you in that are pain-free. So when you're experiencing pain, you want to try and train pain-free, because the pain-free range is where what your tissues can handle. And then you would want to build into that. So the other thing is just adjusting your running. So like for the lady who asked about the 15-mile run, you could kind of tail back down to 13 miles and see how that is. You just adjust. Yeah, you'd have to adjust. But yeah, definitely go see somebody if it's limiting you and it's not improving.
Okay. Sure. When, like, for example, I'm observing how my knee is going, right? Okay, I think it's gonna be okay. But how is there like a duration? Like, how long will I observe it? Would it be 2 days, 3 days, or like a week until I see a professional, or that depends?
Yeah, that'll be kind of up to you. If it's, let's say you go on a run and now your knee's hurting, so you take a week off and the knee pain is better. But then you go back and you run again and the knee pain comes back. That's kind of where it's like, why is this happening? This is something I'm doing when I'm running. So then you would want to get it looked at.
Got it. When you say look up, which professional? Who do we look up? Like, is there anything specific, or do we go specialist or general first? Or?
Well, I'm a little biased, so I'm going to say
physical therapist. All right.
If you're looking, because there's a lot of other really awesome professionals that you can go to. So chiropractor, acupuncture, all the recovery people that do the cupping, the massage.
Oh, yeah.
You could definitely try all of that. The only thing with that is if you're struggling with weakness somewhere or poor movement mechanics, the profession that looks at that is physical therapy. So therapists, you're going to want to find somebody who specializes in sports and running for sure, that can video you. If your therapist is not taking a video of you running and your knee pain is from you running, then you probably want to go somewhere else. You could go to an orthopedic doctor, of course, if you think it's more serious. But an orthopedic doctor is going to tell you to rest, take anti-inflammatories, and if it's really bad, let's do a cortisone shot. And if nothing fixes it, then maybe I'll go in and do a surgery. Let's go. Or
stop running. I said stop running.
Why are you running 15 miles on the sand?
Yeah. Well, I do believe whenever I see, like, for example, Dr. Michele or other physical therapists, it's more of like, it's not just a Band-Aid, like what you said. It's more of like, how can I really not have knee pain? So for ever since I've seen Dr. Michele, my running or my cycling has been better. As long as my training is good, because it's not just what Dr. Michele. Your training has to be like training progression, baby step. All right, let's see. Last question: what exercises do you recommend for when the patella moves after a run and stop using the brace?
When the patella moves?
Yeah, I think the athlete uses the brace, so the patella won't be moving.
Okay, so
can you expand more onto that?
Can I show a picture? It would be.
Yeah, please.
Okay. So let's see. Actually, sorry, I'm going to open up something else here that might be more helpful. But so the patella moving, basically the patella is going to sit on the top, your femur, which is your thigh bone. and it sits on there like a train track. Okay, so I usually explain like the patella is like a train, and then the femur is like the train track. So if your femur is moving like in and out, like that one picture of the runner we saw where the knee's diving in, the train can't ride on the train track smooth, right? So you're going to develop pain around the kneecap, and that's going to make it feel like maybe your kneecap's moving in and out. The other scenario is you just have like kind of loose ligaments. If you're born that way and your ligaments are loose and your patella kind of sublux, then you probably want to just keep the brace on, and you actually want to work on your glute muscles. So I do have some exercises because your glute muscles are going to control your femur. So let me just open this. I'll make it quick for you guys, but I do have a couple exercises I can just roll through really quick, if that's okay.
Yeah, please. So aiming for hip stability then, right?
Yeah. Yep.
Okay, got it.
The ones I'm going to show you, they may be a little advanced. So, you have to make sure you're not having knee pain when you're doing them. If you're having knee pain, then don't do them, and ask somebody that's a professional to help you to do them.
Mm-hmm. Yep.
So the first one is you can do this. You toss a mini band around both your legs above your knee. This is called a fire hydrant hold. And you're going to kick your knee back and turn it out so you feel this glute. Okay, the reason you're doing this is it's just activating your glute max, your glute muscle. Okay, you can start at 30-second holds and build up to a minute. Okay, so you can do that as a warm-up. This exercise is good. It's squatting with weight. This is good because it helps you load, and you can practice loading standing on two legs. So you want to really make sure when you're doing these exercises that you're focused on the alignment of your legs. So maybe you can do them in front of a mirror. That would be helpful. If you don't have a hex bar, you can use dumbbells, kettlebells, a weight vest, anything. But the main idea is look at your knees and make sure they're tracking straight up and down, diving in.
Very important.
3 rounds of 12 or 15 that you can do would be good for triathletes. This one's going to be more advanced. So this is kind of like 1.5 legs, not 2. You're training this one in front. Okay. The one in the back is just for balance, and you can hold some weights at your side. Try it without weights at first, but you're basically just strengthening your hip. And what she's doing is she's squatting down and coming back up. It looks kind of like a lunge. And the same idea, as you're going up and down, you want to make sure your knee is staying straight. Mm-hmm. Same idea, 3 sets of 12 to 15. And then you have the step up. So this one is going to be the hardest one because this is fully on one leg. So you can try this. If your knee's hurting, it may mean that your muscles aren't strong enough to take the load yet. But you're basically, you're putting your foot, this is about a 12-inch step. You can find what works for you. And you're going to just do a full step up onto it. So you can see the model just did a step up. And the same idea, as you step up and step back down, you just want to make sure that that your knee is staying straight. So you can give those a try and certain variations of that.
Awesome. Good. Well, thanks for showing that, Dr. Michele. So I wanted to make sure that everyone knows, make sure it's, again, baby step. You heard Dr. Michele, she said, do first like 30 seconds. Okay, don't go overboard. It's not like going jump. So again, it's training progression. Well, actually consider it as training also. Yeah, because some athletes are go-getters. They're like, I want to get it now, right? Yeah. So I think, so now my question is like, so do you have top 3 things that you could recommend athletes who are actually experiencing knee pain, or how can they prevent knee pain before it even happens? Like, what are the top 3 things that you could actually recommend us, actually, because that includes me?
Okay, definitely strengthening. Okay, so I feel like a lot of times what happens is we have athletes that come in of all types of athletes, not just triathletes, but and they just are sports specific. So they just run, swim, bike, or they're just playing basketball, they're just playing soccer, and they're not doing any sort of cross training. They're not strength training. So I would say even when you're in season, even when you're in season, 1 or 2 days of strength training in season. While you're out of season, 2 to 3 days of just really specific strength training. definitely hitting your glutes. Your glutes are super important for hip stability, and it even trickles down all the way to your feet. So strengthening your glutes, cross training, and then probably, this is random, we didn't really touch on it today, but make sure your hip flexors are stretched out. Because if your hip flexors are really tight, that could cause a lot of problems in your low back down to your knee, which can go to as well. So
got it. Cool.
yeah.
Great.
Yeah.
Awesome. So I think I asked everything. So now if I have more questions, or if other athletes have more questions, or actually I remember now.
Yeah.
You mentioned about run video analysis or the cycling analysis. Why would you actually recommend that? Because I did get it, and you know, I learned a lot from my techniques. But why? What's the purpose of it? Just, you know, give us why.
Yeah. The main thing is that it's really specific. So you're not guessing. You are looking at exactly the activity you want to do, exactly the activity is causing your pain, and you're going to know exactly what's causing your knee pain. It's not like, well, okay, you know, your hamstring's a little tight, so potentially it's causing this. It's like, no, when you're looking at your running, you could say, okay, well, when you're running, you're doing this, and having weakness in your hand, in, you know, this, and this could cause that movement fault. So let me test it. Maybe you're positive for 2 out of 3 of those things. So it just really narrows it down.
Good. I'm glad you said that. Because like, for example, the questions that I gave to you, well, Dr. Michele, maybe it's because of this. And your answer is just like, maybe. Dr. Michele is really specific. She's not going to say yes or no if she's not really testing it, because she wants to be, that's why she has all this analysis that she does in her clinic. So if other people actually want to see you for, you know, additional questions, or like, for example, analysis like that, or they want to ask you questions, how will they be able to reach you?
Yeah, so you can totally email me. I could post my email. Maybe, I'm not sure if you can see the Zoom, but maybe Shangrila, you can post my email.
Okay, we will do that.
So yeah, and I can get back to you. It sounds like everyone's from a bunch of, you know, all over.
Yeah.
But
in and outside the United States, actually.
Okay, awesome. Yeah. So I'm in Southern California. So if you're in Southern California, you can always stop in the clinic as well. But yeah, I mean, feel free anytime. I'm more than happy to answer any emails, any questions that you guys have. So that's
okay, great. Thank you so much.
Yeah, of course.
That's it. Well, have a great weekend, everyone. Thank you again. Till next time, Dr. Michele. Bye.
Thank you. Bye.